What do omega-6s do? Omega-6s come from vegetable oils, right? Omega-6s. Well, omega-6s, they rev up prostaglandin 1. That's good, right? But they also can rev up prostaglandin 2, the bad guys, and turn into arachidonic acid. Now, notice it's kind of nerdy first thing in the morning. Just get the big picture and move on. Just know that what we need to be doing with our patients is we need to be drastically increasing omega-3 and reducing omega-6. We need to get people to reduce their the vegetable grain intakes and really ramp up their omega-3s. What in Paleolithic times, I say that right? Sometimes Southerners can't say these big words, but if we look at in the old times, what the ratio of omega-6 to omega-3 was something like 1.5 to 1. So for every 1.5 grams of omega-6, you got 1 gram of omega-3. In our country now, it's 12 to 1. Now, those with autoimmune diseases that you see in your practice, rheumatoid arthritis, lupus, Sjogren's, Reiter's, those folks are going to have a 20 to 1 ratio. 20 times the amount of omega-6 creating inflammation to 1 omega-3. So what's happening is this. We're creating these storage sites called fat, and the estimates now are that 60% of the population is carrying around at least 10 extra pounds, if not more, I think 30 pounds. So we're carrying around about 30 pounds of extra inflammatory chemicals. That's where it's stored, right? And all day long, these chemicals are being released, causing inflammation. You've got to change that relationship. And the only way to do that is high doses of fish oil. Can you take flax? You can. However, flax, as you astutely know, a lot of times you can't change that short-chain fatty acid into the longer-chain EPA and DHA. So some people genetically cannot do that. They are not born to be able to do that. So I don't take that risk. People will complain about the taste of fish oil and the burping it up and all those things. Have them take the fish oil and put it in the freezer. And that'll take care of that. How am I doing on time? Okay. I'm going to try to leave a few minutes here for questions. I'd like to shift gears from that. And we could do a whole two hours on that, because it's so important. All your patients that are coming into your office have this relationship of too much inflammatory chemicals in their body, too much omega-6, because everything we eat, even the livestock we eat is loaded up with grain. Okay? Let me share this real quick. I mentioned about cholesterol. So now that I can really piss some people off, let me go ahead and talk about that. Because I know some of my medical doctor friends love to just squash that cholesterol down. And now it's recommended that we put statin medications, Lipitor, Zocor, Mevacor, we put them in our drinking water. Because cholesterol is such a terrible thing. Well, know this, you have to have cholesterol. If you didn't have cholesterol, you'd die. 85% of all cholesterol in our bodies is made by the body on a continuous basis, because you have to have it. Only 15% is controlled by diet. That's why you really cannot do it through diet alone. That's why, thank goodness, we got Pfizer to supply us with Lipitor. $10 billion industry. But the problem with that is this. You need cholesterol to make certain hormones. You need cholesterol to make the sex hormones. You need cholesterol. 7% of the brain is cholesterol. 70% of the brain is fat. Fat does more than hold your britches up. Fat it's what makes the cellular membrane. So it allows one brain cell to talk to another brain cell, to talk to another brain cell. That's why the research shows that individuals who are low, and especially DHA, omega-3, suffer from mood disorders, Postpartum depression, the major reason for that is low DHA levels. Whole book on that, my treating being anxiety and depression about that. But what I want to share with you about cholesterol is the worst thing we could be doing is squashing cholesterol. As we've seen with the last 20-something years, we have seen heart attacks actually go down a little bit. Even though one person dies in the United States, I think every 7 seconds from heart-related or cardiovascular illness. We have seen a reduction in heart disease since statin medications came on board. However, we've also seen congestive heart failure, which was unheard of 20 years ago, skyrocket. Could statin medications be causing congestive heart failure? In my opinion, and other experts out there who've done the research, probably so. Because what does statin medications do? They block CoQ10. CoQ10 is the spark plug. It's the power plant of every cell, especially muscle. And what's one of the largest muscles in the body? The heart. So when we're starting giving people statin medications, we're killing the heart muscle. And that's why you'll see a lot of your patients that come into you that may be on these medications, they'll have, what is the number one side effect of them? Muscle pain. What many doctors don't know is that also these medications have a very high risk of polyneuropathy, causing neurological problems, as well as amnesia, mood disorders, and other things. Men are more likely to commit suicide if they're on statin medication. You're more likely to die from a heart attack or a stroke if you have low cholesterol. Now, I'm not making this up. I wrote a book about it. And it's all the studies that came out of New England Journal of Medicine, British Medical Journal, and The Lancet. This is right out of their stuff. Now, my book will be out in the spring, and I'm going to have to get an alias and move from Birmingham, Alabama, because on my street there's 9 medical doctors, and they're not going to be happy with that. Now, they all already think I'm crazy anyway. They know not to debate me, but they think I'm crazy. So what I want to share with you there is that the fat that is in us is very important. And the worst thing we could do is start to shut down cholesterol. The other worst thing we could do is go on low-fat diets. Many of the things that we've done in the past, or many of the things that our patients have done in the past, have really sabotaged them. The low-fat craze 20 years ago was probably one of the big reasons why we have so much ADD, ADHD, and so much problems with mood disorders, because you have to have fat. What happens when you go on a low-fat diet, by the way? Not only do you reduce the fat, you reduce what? Protein. And the amino acids that make up a protein are what make the brain chemicals. If you have a patient that's taking Effexor, which is a serotonin reuptake inhibitor and a norepinephrine reuptake inhibitor, those are gasoline additives. Why not use the raw ingredient that makes norepinephrine? What is that? You may know that in this audience. Well, it's phenylalanine or L-tyrosine that turns in phenylalanine. Why not use the amino acids that make these things? That makes more sense to me.